So this one, blood glucose level, right? We are talking about the laboratory values, what is frequently asking question in NCLEX board. So now we talk about the blood glucose level. So why blood glucose is important? Blood glucose is important because if it is not in normal, right, they can cause hyperglycemia. If it's less than normal, they cause hypoglycemia. And this is also related to the diabetic mellitus. So blood sugar normally fasting, it is 70 to 110 milligram per DL, 70 to 110 milligram. Fasting condition, but it's random. It is less than, target should be less than 200 milligram per DL. Fasting means if you go to the lab without eat, without breakfast, lunch, anything, fasting. But if you go random, that time the target should be less than 200 milligram per DL, right? So if it is more than 110, indicate diabetic mellitus, indicate the diabetic mellitus. And here we said the most confirmatory test of diabetic mellitus is called hemoglobin A1c, the confirmatory test for diabetic mellitus. So diabetic mellitus, the blood glucose altered. So this is the normal blood glucose. This blood glucose will be altered. Maybe hypoglycemia when less than 70 or hyperglycemia when more than 110 due to insufficiency of insulin production by the pancreas or insulin resistant cell in the body. So blood sugar level is altered because of deficiency or resistant of insulin, right? And we know insulin is produced by pancreas. So there are two types of diabetic, basically. One is type 1 and another is called type 2. There are two types of diabetic. So one is type 1 and type 2, right? So type 1 diabetic or type 1 diabetes mellitus, it is the destruction of beta cell in pancreas due to autoimmune dysfunction or exposed to the toxin or virus. Sometimes type 1 diabetic is called insulin dependent because type 1 diabetic is treated by insulin. So insulin is the only treatment option. But type 2 diabetic is called non-insulin dependent because type 2 diabetic sometimes treated by oral hypoglycemic agent. Oral hypoglycemic agent like here metformin, glucophage, right, or glipizide. So this is the oral hypoglycemic agent for type 2 diabetic. So type 2 diabetic mellitus, progressive insulin resistant and decrease the insulin production. Usually type 2 patient, usually I said, obesity or inactivities, their lifestyle not that much good, sedentary worker or patient has hypertension or high triglyceride level in type 2 diabetic, I said. Easy way to remember that type 1 diabetic most common in the children or patient has a family history is positive. But type 2, yes, family history, there are no family history, and it is also most common in adult, right? So what we have to know first, the blood sugar level. What are the normal blood sugar level? Here we have to know. So it is 70 to 100. So as I told you, if it is less than 70, right, we say hypoglycemia. But some of the book agree with you, the blood glucose level less than 60 milligram per DL is called hypoglycemia. Hypoglycemia. So when patient has a hypoglycemia, hypo means low blood sugar. What are the signs and symptoms? This is one funny picture I left. It can help you. Some of the students like it. It is easy to remember. So I said symptom of hypoglycemia, patient feel hunger, irritabilities, also the body shaking. They feel headache or diaphoresis, means sweating, pale or cool skin, tachycardia, increase the heartbeat, called tachycardia, or decrease the level of consciousness and feel dizziness. And also difficult of concentration. They have a difficulty of speech. It's called the slurring speech, or they feel blur of vision, anxiety, and finally seizure and coma. So this is the sign and symptom of hypoglycemia, right? So as I told, 70 to 100, if your patient blood sugar level is more than 110, or if random blood sugar is more than 200 or more than 250, we call hyperglycemia, right? The most common sign and symptom of hyperglycemia are hyper means high blood sugar level. Easy to remember, 3P we use, like patient feel polyuria, need to go for urination, frequency of urination is increased. They feel polydipsia, and polyphagia, right? So like very thirsty, all the time they are thirsty, stomach pain or irritabilities. So I told you the patient who have hyperglycemia, they can feel polyuria, polydipsia, and polyphagia. Easy to remember, 3Ps. Polyuria, increase the frequency of urine. Then polydipsia, excessive thirstiness. And polyphagia means always feel hunger, increase the appetite. Also involuntary weight loss. So the patient who is hyperglycemia, their skin is dry and warm, they are dehydrated because too many times go urination, and also decrease the skin trigger or weak pulses, dry mucous membrane. They are the sign of dehydration, and dehydration is most common in hyperglycemia. So the patient who have hyperglycemia, a good RN or doctor can easily find out to check their breath order. They have a fruity breath order. Fruity means fruits like smelling, right? And the patient who have the hyperglycemia, they have a special respiration, and this is called Kussmaul respiration. The patient who have hyperglycemia, their respiration is called Kussmaul, Kussmaul respiration, right? Kussmaul respiration means increase the rate and depth of respiration. NCLEX board asks a question, what type of respiration in case of hyperglycemia? They wrote Kussmaul, or they said rate and depth, increase the rate and depth of respiration, right? And this is called Kussmaul respiration. So this is very important. We have to know for NCLEX board exam. Now we are going to talk about the little bit information about the hemoglobin A1c, because hemoglobin A1c, the diagnosis, confirmatory diagnostic test of diabetes mellitus, is a significant test for diabetic. And we have to know what are the expected range and what are the goal of diabetic patient and what are the goal for pediatrics or normal patient. So diagnosis of diabetes, we have to check the blood sugar, like I said, casual blood sugar, random blood sugar more than 200, and fasting blood sugar more than 110 milligram per dl, more than, I said, maybe 126, maybe 125, and random is more than 200, maybe 250. So blood sugar more than. Another test we have to do is called glucose tolerant test. So glucose when more than 200 milligram per dl with a oral glucose tolerant test is called OGT, oral glucose tolerant test. If it is more than 200, we can say the patient has a diabetic. But how we have to be confirmed about my patient to check the hemoglobin A1c? So hemoglobin A1c, the best indicator for the treatment compliance. Expected range of hemoglobin A1c is the 4 to 6%. 4 to 6%. Some books said 4 to 5.9%. Acceptable target for diabetic patient, especially diabetic children, it is 6.5 to 8%. And goal for patient with diabetic hemoglobin A1c less than 7%. Less than 7%. So I want to recap it, my friend. So expected range of hemoglobin A1c for healthy individual, 4 to 6%. It indicates patient is okay. But if the patient is a pediatrics, right? So expected target, if the patient is diabetic, that times acceptable target for diabetic patient, it should be 6 to 8% is okay if they are diabetic. But the goal, what should be? So suppose the patient, your patient is a diabetic, then what should be the target of hemoglobin A1c? It's called the goal for patient with diabetic is hemoglobin A1c less than 7% is the target for hemoglobin A1c. And now we are going to talk about another most important information is called how to take care of the patient food, right? It's called Diabetic Mellitus food care. NCLEX frequently asking the question, how we have to take care. One, I said we have to see the patient food, inspect the food daily. Every day, when you educate your patient or when you check the patient, you have to check and see their food. And always taste the water with the hand. So wash your feet daily with a little bit hot water, lukewarm water, and so. So before you use the water, you have to check the temperature of the water. So test water temperature with a hand and use lukewarm water for washing food. And then we have to dry the food. So dry the food very gently and thoroughly after bathing. Then we have to apply some moisture. Apply the moisture to the feet, but not between the toes. And also wear the cotton sock, right? No synthetic fabrics. So check the foot for any kind of blister, cut, or redness. If you see some of them, you have to contact with the healthcare provider. So as I told, you educate your patient, they have to wear the cotton sock, not or no synthetic fabrics. And barefoot or wear open toes or heel, do not go barefoot. So it is very dangerous for them. Never walk barefoot, right? Even indoor or outdoor. Use food powder, right? Or always check the sweaty foot. You have to make dry. When you cut the nail, always cut the nail straight across. Ideally, after bath or shower. So trimming your nail straight across, right? Very important for NCLEX board. And always we have to check the shoes. Check the shoe for any kind of object that can cause the injury. So you have to check inside or outside if any cutting or anything, so then can cause the injuries. We have to remove. And do not use over-the-counter medication product such as the product for corn or cellulitis. We do not buy any medication over the counter for the food care like a corn or any hard tissue to remove. Do not apply the heat pad. We will not apply the heat pad or hot water bottle to the feet. So diabetic patient food care is super important. We must know, right? Now another question comes when we check our patient, okay, and what we have to educate them. Patient teaching when they are sick. So very important, please follow me. Diabetic mellitus patient teaching when they are sick. We have to monitor the blood glucose more frequently, means every 3 hours. When they are sick or acute attack of diabetic, we have to frequently check their blood sugar level, means every 3 hours. Test the urine for ketone every 3 hours, right? ketone. So because this is a complication of diabetic, right? Like diabetic ketoacidosis is called DKA in type 1. In type 2 is called hyperglycemic hyperosmolar non-ketotic coma, HHNK. So type 1 patient diet complication the DKA, type 2 is hyperglycemic hyperosmolar non-ketotic coma. So I said we have to check the urine to see the ketone bodies. Ketone bodies, they are byproduct in metabolism. So ketone body every 3 hours we check, and do not skip the insulin or anti-diabetic medication when they are sick. So when, if the patient is acute attack, we have to be concerned. They do not skip the insulin or anti-diabetic medication. So always stay hydrated. Always stay hydrated. So basically, the chance of develop dehydration because they go frequently to the toilet for urine or pee. So chance of develop dehydration. So we have to make sure patients are not dehydrated. So stay hydrated. Drink 2 to 3 liter water, but sugar-free, non-caffeinated liquid per day. Also notify the healthcare provider for blood glucose if it is more than 250 milligram per dl. If patient has a fever, temperature is more than 38 degree Celsius, immediately inform healthcare provider. As I told you, we have to check the urine for ketone. If we get urine positive for the ketone, or if your patient is confusion or rapid breathing, means small respiration, always we have to contact with the healthcare provider. So blood sugar level always we have to keep in the normal range. Otherwise, uncontrolled diabetes mellitus eat the eye and causes the retinopathy. They is very dangerous for your nervous system and develop the diabetic neuropathy, right? And they are really bite your heart and causes cardiomyopathy. They leaks your brain and causes the stroke. And also affected your food is called diabetic food. Even they eat your kidney and causes the diabetic nephropathy. So uncontrolled blood sugar or uncontrolled diabetic causes eye problem, causes nervous system problem, causes heart problem, causes kidney problem, brain problem, right? And they are called retinopathy. Then they cause diabetic neuropathy, they cause diabetic cardiopathy and diabetic nephropathy, right? So this is super important for our NCLEX board. So one most important point about the management of patient, diabetic patient, which is a treatment. So management of hypoglycemic, especially hypoglycemia. Keep in mind, if your patient is a diabetic hyperglycemia, but when you give them insulin for hyperglycemia, patient has a chance of develop hypoglycemia, hypo. So if patient is really bad and they are unconscious, right? Unconscious, it is very important. So management of hypoglycemia in unconscious patient and or conscious patient. Super important. If your patient is unconscious, right? Unconscious, I said. So treatment of hypoglycemia, right? So management of hypoglycemia in conscious or unconscious patient, hypoglycemia. And as we know that sign symptom of the hypoglycemia patient feel weak, hunger, and also the shaking. So if your patient is conscious, then you have to give them some food, right, orally. And this food increase the blood sugar level. But if your patient is unconscious or patient has a seizure, we never ever give anything to the mouth. Super important. I want to recap it. So if your patient is a conscious patient, then we have to give them 10 to 15 gram simple carbohydrate. 10 to 15 simple carbohydrate, like 4-ounce juice or soft drinks or milk, right? 8-ounce milk. After the food, we have to recheck the blood sugar, right? And also follow with a complex carbohydrate. If your patient is unconscious, or we have to check the loss level of consciousness. If loss of consciousness or unconscious or patient is seizure, we never give anything by mouth. We administer intramuscular or subcutaneous glucagon. So glucagon work just opposite the insulin. Insulin reduce the blood sugar, but glucagon increase the blood sugar. So administer intramuscular or subcutaneous glucagon. Repeat in 10 minutes if patient is still not conscious. Once the patient is conscious and can swallow safely, have the patient consume a simple carbohydrate. So as I told you, this is really important how we have to deal or the patient if the unconscious. And before to go the next here, I want to share something more about the diabetic patient teaching. Okay, so diabetic mellitus or patient teaching, so self-monitoring blood glucose level. So when patient ready to discharge to the home, you have to educate them how to check their own blood sugar, right? So tell them do not puncture the pad of the finger or use the skin to either side or finger pad for better blood flow and less pain. And perform before meal or at the bedtime. So when you educate your patient how to check the blood sugar at the home, you must tell, check the blood sugar level or perform it before food or meal or before at bedtime. So, and how they have to admin the insulin, how they have to admin the insulin, right? How they have to admin the insulin. Basically, the insulin, I have the other lecture I have take about the insulin. So you can, I believe you know that. So, insulin administered, we have to tell, rotate the subcutaneous injection site to prevent lipohypertrophy. So if your patient give the insulin the same place, do not rotate, the chance of develop lipohypertrophy. Always administer 4 to 5 injection in one side before switching to another side. Injection always has to give to the 90-degree angle, right? So you say here, in case of the diabetic subcutaneous, rotate the side to avoid lipodystrophy here. And subcutaneous injection, I said, injection at maybe 90 degrees or angle 45 degrees, subcutaneous angle. 90 degree you give if your patient is an obese patient, but 45 degree if your patient is thin. Always mixture the insulin, draw up the clear before cloudy. So when we withdraw the insulin, always clear insulin draw first or short acting insulin draw first, then we go for cloudy or long acting insulin withdraw. We never mixture the long acting insulin with other insulin. I want to recap it. When we mixturing two insulin, mixturing insulin draw up the clear or short acting insulin first, then go for withdraw the cloudy insulin or long acting insulin, and never mixturing the long acting insulin like insulin glargine with any other insulin.